Hi, I'm Scott Wester, and I have the privilege of serving as President and CEO of Cottage Health here in Santa Barbara, California. Congratulations on you completing medical school and on taking this next important step in your journey to a residency. Thank you for considering Santa Barbara Cottage Hospital for our internal medicine, general surgery, diagnostic radiology, or pediatric programs. Cottage opened in 1891 and is the largest teaching hospital on the California coast between Los Angeles and the Bay Area. As for residency programs, ours began in 1921 with our surgical residency program that is not only one of the oldest in California, but also one of the most established in the Western United States. And we're proud on how we continue to build on our legacy. Here you will find an organization as supportive as it is stimulating and just an amazing place to work. In fact, we are recognized as one of the top 20 best places to work in healthcare by Fortune magazine, and over 100 physicians now practicing in our community completed their residencies here at Santa Barbara Cottage Hospital. We are so fortunate to attract top medical students to our residency programs, and we'll be honored to have you join our team for this next phase of your medical education.
Santa Barbara Cottage Hospital is an acute care teaching hospital and level 1 trauma center, the largest of its kind between LA and the San Francisco Bay Area. Annual admissions top 20,000 patients, and our ER cares for more than 70,000 patients each year. We also welcome about 2,400 babies into the world each year. Here's the lobby, where patients and visitors are greeted and escorted to wherever they need to go. We also have a convenient gift and coffee shop right here. Of particular interest for medical staff, the Sage Medical Library is the largest such facility on the Central Coast. Physicians, staff, students, patients, and their families have 24/7 access to extensive resources, including PubMed, Medline Plus, and ToxLine. For medical education and community events, the new amphitheater features state-of-the-art equipment and seats 144 people. Next to the amphitheater is our museum that features historical displays dedicated to our storied history. Santa Barbara Cottage Hospital is also recognized for its landscaping, green space, peaceful environments, and healing arts. Our high-quality, state-of-the-art rooms ensure patients and their loved ones stay as safe and comfortable as possible during their time here. Our cafeteria features food predominantly sourced from local organic farms, and our menu items receive rave reviews from patients, visitors, and staff. Santa Barbara is a place like no other. Known as the American Riviera, the city of Santa Barbara rests between the Santa Ynez Mountains and the Pacific Ocean. Its Mediterranean climate means you'll enjoy the outdoors all year long. The Santa Barbara waterfront area is popular among locals and visitors alike. A great place to take a long walk or bike ride along the beach, enjoy local restaurants and shops, and swim, surf, and sail. The Santa Barbara Zoo is a favorite for families. It sits on a hilltop with large open spaces and overlooks the Pacific Ocean. There are lots of fun cafes and boutiques all around the city. For great coffee, Santa Barbara is one of the few places in the country where it's locally grown and roasted and served up in some of the coolest coffee houses anywhere. You'll love exploring the outdoors here with our miles of hiking paths, great public parks and open spaces, botanic gardens, and nearby Lake Cachuma. The Santa Barbara wine country is just a short drive away in the picturesque Santa Ynez Valley, and there's rich farmland all around that produces year-round organic produce you can pick up at local farmers markets and stands, and festivals celebrating the local crops of lemons and avocados. There's also a rich history in Santa Barbara. The city's Spanish heritage is well preserved at El Presidio, founded by Spain in 1782, and at the Santa Barbara Mission, the site of many cultural and historical festivities. Santa Barbara hosts an abundance of cultural offerings, from theater, opera, and symphony performances to the world-famous Santa Barbara International Film Festival. We have art museums, art walks, a museum of natural history, and the new Moxie Museum of Exploration and Innovation. This is just a tiny glimpse of our beautiful city. We hope to see you here soon.
Welcome to the Cottage Hospital Internal Medicine Residency Program and our virtual video introduction. Thank you for your interest in our program. My name is Andy Gersoff, and I'm the program director. Although the hospital is beautiful and well-resourced, it's important to realize the internal medicine resident service almost entirely takes care of patients who would otherwise be at a county hospital. Our continuity clinics are at the county public health department. The hospital is very academic in terms of evidence-based medicine, research opportunities, and conferences. Our ABIM pass rate continues to be excellent, and our graduates do very well in matching to fellowships. Probably most important, however, are the people and work environment. There is a wonderful sense of teamwork and camaraderie among the residents and between the residents and faculty, as well as between residents and the rest of the hospital staff. The hospital is a friendly and welcoming place to work, one that clearly values the presence of residents. The program itself pays much attention to work-life balance, teamwork, well-being, and diversity, along with an obvious commitment to patient care and clinical education. Now I'd like you to meet some of our past and current residents.
So our days start early. They start with a lot of coffee. We pre-round on all of our patients before we get started with kind of our main event of the morning, which is morning report. Morning report's one of my favorite parts of the day. We take our interesting cases from the night before, the day before, and kind of break them down and consider all the different possibilities. And it kind of helps you build your own style based on the different ways everybody would choose to approach the case. After a morning report, we usually split off and do work rounds. Each team meets up with their teaching attending for the week and go through all of their cases one by one and kind of create a game plan for the day. My other favorite time of the day is around noon when we get ready for noon conference. Our noon conferences last about an hour, Monday through Friday, and we do a whole range of different subjects. So we get a lot of really wonderful subspecialists to come in and teach us a little bit more about their specialty.
You come in here instantly taking control of patients, transitioning from medical school, and you have that sense of autonomy from day one.
You're handed your patient list and you are responsible for those patients, but you have your senior resident and your attending looking over your shoulder, making sure that everything is going okay and you have a safety net.
The program at Cottage does not have fellowships above it. And what that means is the internal medicine residents are really responsible for many of the things that subspecialty fellows would be responsible for at other programs.
The teaching and teachers at Cottage Hospital are phenomenal. And that's without a doubt what makes Cottage a hidden gem in California. It's hands down one of the best learning environments in medicine.
With a small number of teaching faculty, they can really take the time to learn about you as a person, learn your strengths, but more importantly, learn your weaknesses and providing through constructive feedback, the opportunity to become a better clinician and turn those weaknesses into strengths.
Having excellent coordinators providing you every step of the way with new updates, very responsive to emails, and always answering the millions of questions that you have as an intern is priceless.
We're all here to learn, and they want me to learn and want me to grow and be the best doctor I possibly can be. So I really admire and respect the doctors that we get to work with, and I think that's part of the foundation of why we all have such a good rapport, both as residents with each other and with our attendings.
All of the consultants are very, very accessible by phone, text message with quick responses, and if you really need it, the help is there and it's there fast.
I was pleasantly surprised with the amount of focus there is on your own personal growth as an intern, as well as encouraging participation, encouraging constant learning. Sometimes services can get swamped, and especially as an intern, you'll feel like you're drowning. And I've been fortunate to have the seniors always available to provide any extra help.
I think the best aspect of this program here at Cottage is the fact that we're really well supported for our mental health as well as our well-being as an individual.
Self-care is very important with these types of responsibilities, and I do feel like the opportunity is here and the supportive environment is provided for me here.
After we're done with the day, it's not uncommon for us all to get together, go out for a glass of wine, have dinner together, and just kind of generally hang out.
People often suggest that you can take a day off if you need it, and without any questions or explanation.
The camaraderie among us was unlike anywhere I've ever been. If someone was struggling, others will step in and try to help carry the burden without a second thought. I love my co-residents. We're all very good friends, and I know that I can depend on them in a pinch, both personally and professionally. Santa Barbara is an amazing place to live and pretty much has anything that you'd like to do. Great food, outdoor activities, beaches. I could go on, and I really miss it.
The residents would gather a lot and go to the beach, go for hikes together. We have many holiday parties throughout the year, so we're a bit spoiled here.
Cottage could not have done a better job of preparing me. The breadth and depth of patients that you see that come through the doors at Santa Barbara Cottage Hospital will provide a well-rounded base of knowledge moving forward in your career.
Without an exception, the feedback we get is that our residents are ready. They are strong, they are ready.
Looking back on my first day of intern year versus where I am now, I would not be able to take care of the patients in the way that I can now, and I feel really competent and confident going into fellowship based on my experience here at Cottage.
You can expect to be cared for, taught, with high expectations, but also support as we give you the autonomy and the responsibility that you need to go on for a successful career in medicine.
Thank you for your interest. I hope this video has provided you with a good sense of the intangibles of our program, and look forward to meeting many of you in the future